Welcome to Medicare 101. In this video, we're going to discuss the basics of Medicare and take a little deeper dive into Medicare Part A and Part B. We're going to discuss some of the costs associated with Medicare so that you can help develop a plan to manage the costs associated with your medical expenses as you move through your senior years. Let's dive right in. So basically, 90 days before you turn 65, about 3 months in advance, you're going to get a red, white, and blue card in the mail. It's your golden ticket, and it's going to say that you have now got Part A and Part B of Medicare. Well, what does that mean? Beside the Part A, you'll see that it says hospital coverage. And beside Part B, it says medical coverage. So Part A is designed to pay for your hospital expenses. I like to say it pays for rental on the motel room. It pays for inpatient hospital care, as well as it's going to cover some skilled nursing care and some home health care, hospice care, things of that nature. Part B is designed to cover everything inside the room. So the physician, the services, the supplies, durable medical equipment, doctor's visits, lab work, all of that is covered by Part B. So A is your hospital coverage. B is your medical coverage. Those are the entitlements. Those are what you automatically get enrolled in when you turn 65 or you're permanently disabled. Now, Medicare Part A has no cost associated with it. Now, we know nothing's free, so all the years you worked and contributed to Medicare, that funds Part A. Part B will be held out of your Social Security if you're drawing Social Security. If you're not drawing Social Security yet, Medicare Part B will be billed to you directly, typically on a quarterly basis. Now, Part B will be held out of your Social Security before you get it. The cost in 2024 is $174.70 each month. That will come out of your check. That pays for Medicare Part B. So A is free, B, $174.70 a month. Now, that's your basic Medicare coverage. You're going to receive information in the mail. I bet your mailbox is full. You're going to see advertisement on television, on the radio about Medicare Part C and Medicare Part D. What in the world are they? Well, they are alternative insurances that are available to you that you would have to purchase outside of original Medicare A and B. Now, Medicare Part C is Medicare Complete or Medicare Advantage. Medicare Advantage is a private insurance plan. It is facilitated by private insurance companies, and it is a replacement for original Medicare A and B. You would disenroll from original Medicare and enroll in a complete health plan through a private insurance company. This is something that we will talk about in one of our other Medicare videos. There's also Medicare Part D. Medicare Part D is designed to cover your prescription drugs. It's your drug coverage. Medicare Part D is also facilitated by private insurance companies. It's something you would want to have in addition to original Medicare A and B. Okay? So, original Medicare A is hospital coverage, B is medical coverage, C is a Medicare Advantage or a complete health plan that would take the place of Medicare A and B, and then Medicare Part D is your drug coverage, covers your prescription drugs at the pharmacy. Now, I want to dive a little deeper into some of the costs associated with Medicare A and B so that you understand what expenses you could expect if you just had Medicare. You didn't have any supplemental insurance. You didn't have an Advantage plan. You just had Medicare A and B. Let's talk about what that would look like. So if you just have Medicare Part A and you go into the hospital, there is a deductible. Medicare says we will not pay anything until you pay $1,632. That is the Part A deductible. You pay the first $1,632, and then Medicare steps in and covers you for the first 60 days. From day 1 through day 60, after you've reached your deductible, Medicare pays 100%. You would pay nothing on your hospital expense. After day 60, that cost goes to $408 a day. So from day 61 to day 90, Medicare covers all but $408 per day. So you would pay $408 per day out to day 90. Now, this is on a benefit period. So what that means is this part of Medicare right here resets if you are out of the hospital for 60 days. So it starts on day 1, you use up to day 60 or up to day 90, and then if you're out of the hospital for 60 days, it resets at day 1 all over again. Okay? So the deductible is annual. This is once a year. Then you have out to day 90, which resets every 60 days. And then beyond day 90, there are what's called 60 lifetime reserve days. So you have 60 days of extended care beyond day 90 provided by Medicare. And in these 60 days, your cost is going to be $816 per day. So after you've hit the 90 days, you start using lifetime reserve days at $816 your cost per day. Now, Medicare Part A also has coverage for a nursing home. So the first 20 days in a nursing home, you are covered 100%. After day 20 out to day 100, your cost after day 20 to 100, you're going to pay $204 per day for your care. So it's $204 in 2024. That's what your cost is in a nursing home or skilled nursing facility. This is Part A. As you can see, if you just have Part A, it can get very expensive as you move through your senior years, and that check engine light comes on every now and then, and you have to have care. Now, on Part B, on the medical side of things, when we look at Part B, there is a deductible associated with Part B as well. So the Part B deductible for 2024 is $240 for the year. That's the annual deductible. Once you've reached the deductible, at that point, Medicare kicks in and pays 80% of the bill. You're on the hook for 20% of all medical expenses. Now, the good news is there's no maximum. The bad news is there's no maximum. So you're going to pay 20% of all medical expenses moving forward. As you can see, if you just have Medicare A and B, although you have comprehensive coverage where you can go any doctor, any place, anytime within the U.S., you have comprehensive coverage when it comes to your care, what you need, anything from a headache to a heart attack. Medicare is very comprehensive as far as what is covered. When it comes to paying the bill, Medicare is not comprehensive. So, as such, you're going to have to decide how are you going to manage these costs associated with Medicare. Well, there's two types of insurance in the private market that help you manage those costs. One is what we call Medicare supplement insurance or Medigap insurance. The other is what's called Medicare Advantage or Medicare Complete, that Medicare Part C that I mentioned earlier. In our next video, Medicare 102, we're going to talk about the Medicare supplement options available to you, and I hope we can dive a little deeper and explain how you can manage these costs with a Medicare supplement policy. I appreciate you stopping in today. If you have any questions, any concerns, please call us here at our office, 573-778-8227. Have a great day.